you have an insurance in the sense that you have a group of pooled participants that you're participating with and have agreed to share each other's costs under the plan document. So some things are covered and some things aren't. And they cover it like insurance. But you don't have like an insurance card. So when you go in, you are going to have to deal with the billing practices of your healthcare provider. And these things have gotten better. When I first jumped on this stuff, it was like new. And so nobody even knew, like when you went into a healthcare provider, like I participate in Christian healthcare, they're like, I don't even know what that is. You know, they're like, okay, are you going to pay? And so I would find that you had to normally pay or like come up with a plan for payment. And then what you do is you submit your bills to Christian healthcare, and they will, or whatever, you know, there's other healthcare plans, and they will reimburse you based on the eligibility of your plan. And it was really good. It worked for me for years. I had a 4-year-old that had ovarian cancer. We dealt with that, paid everybody up front, negotiated all my bills with oncologists, surgeons, negotiated all the bills. So I know what the cash payer experience is like. And then we would submit it. And actually, like the way that it worked is if you could get the bill from the healthcare provider and then I could negotiate the bill down and pay a lower amount, the health share would reimburse the entire bill in a lot of cases. So we had an incentive to try to get the bills knocked down after we were billed. So number one, asking for a bill was always hard. Number two, after we got it, then we would negotiate it down before paying. And it was just interesting. You have the option in that circumstance to wait for your reimbursement money to show up, which could take months, and then pay. But obviously you're going to have the healthcare providers on your back during that process. So you can decide. I've tried both and I've dealt with both, and it's kind of an interesting experience. So